Hi everyone, how are you today? Welcome back. And if you are new here, welcome to my channel where you can learn the real world coding experience. And this is Hong, the coding expert. If you want to pass any coding exam to start your coding career, or if you are already holding a coding credential, working in the field, and want to learn more in order to advance your coding profession, then you are in the right place. Wow, how fast the holidays sneak up on us and how quickly they become a memory. I hope that you enjoy being with your family and friends and have had a chance to reflect on the past year, discovering ways to grow, to excel yourself in life, and exciting new goals. Since this is my first video this year, so I would like to take this opportunity to wish you all a very happy, healthy, and successful year ahead. You may or may not know that IIPC has just announced upcoming changes to the Cbc exam in 2022, and I have received many emails asking me to go over the new exam format and structure in details and how to prepare for it. I understand how anxious you are wanting to know so that you can start preparing for this exam appropriately and effectively. Having said that, without further delay, let's get right into it. Let's talk about the new CBC exam in 2022. Here's the side-by-side comparison between last year and this year's exam. Last year, the CBC exam consists of 150 questions in 5 hours and 40 minutes, which is equal to 340 minutes. So basically, if I divide 340 minutes for 150 questions, I will have an average of 2 minutes and 26 seconds for each question. Starting January 1st this year, 2022, CBC exam will consist of only 100 questions, and you will be given 4 hours to complete the exam. I will do the same basic math. 4 hours equal to 240 minutes. So if I divide 240 minutes for 100 questions, I will have an average of 2 minutes and 40 seconds for each question. So technically, you will have more time per question in the new CBC exam, 14 seconds per question to be exact. Although not every single question will take you more than 2 minutes. For example, when you are dealing with anatomy and physiology questions, either you know it or you don't. So I would not expect you to spend too much time on this question. Just make an educated guess, circle your answer and move on. Don't leave it blank. 1 minute maximum is allowed for this anatomy and physiology question. And if you follow my advice, then you should save enough time to tackle long case study questions. Next, similar to previous year, the CBC exam will evaluate 17 areas of knowledge and a broad range of coding related topics. Most questions present a coding scenario to test your proper assignment of CBT procedure codes, HICPIC Level 2 supply codes, and IC10-CM diagnosis codes. This year, the new CBC exam will only consist of 6 questions compared to 10 in last year, related to surgical procedures on 10,000 series, performed on the integumentary system, which includes skin and accessory structure, pilonidal cysts, wound repairs, and breast. Similarly, on the 20,000 series CBT, the number of questions will also be reduced to 6 questions compared to 10 in last year. The question will be on surgical procedures performed on the musculoskeletal system from head to toe. On the 30,000 series CBT, only 6 questions compared to 10 in last year. It will be covering surgical procedure performed on the respiratory system, cardiovascular system, and lymphatic system. only 40,000 series CBT, only 6 questions compared to 10 in last year. It will be covering surgical procedure performed on the digestive system, which will focus on this area: lips, mouth, adenoids, and tonsil, esophagus, stomach, intestine, biliary tract, pancreas, and abdomen. On the 50,000 series CBT, only 6 questions compared to 10 in last year. It will be covering surgical procedure performed on the urinary system, male and female reproductive systems, including maternity and delivery. On the 60,000 series CBT, only 6 questions compared to 10 in last year. It will be covering surgical procedures performed on the nervous system and will include codes pertaining to the skull, meninges, brain, spine, spinal cord, peripheral nerves, and autonomic nervous system. On the 70,000 series CBT, only 6 questions compared to 10 in last year, and it will focus on both diagnostic and interventional radiology, including diagnostic ultrasound, radiologic guidance, mammogram, radiation oncology, and nuclear medicine. I will make a new video this year on how to code the interventional radiology, selective versus non-selective catheterization, and you will be well prepared for this 70,000 coding series. On the 80,000 series CBT, only 6 questions compared to 10 in last year. It will test your knowledge of drug testing, hematology and coagulation, immunology, microbiology, anatomic pathology, and cytopathology. On the 90,000 series CBT, only 6 questions compared to 10 in last year. It will cover numerous specialty-specific coding scenarios, as well as immunization, dialysis, hydration, chemotherapy, administration, and moderate sedation. On the E&M Evaluation and Management 99,000 series CBT, only 6 questions compared to 10 in last year. It will assess your coding proficiency related to place and level of services, such as office and other outpatient, hospital observation, hospital inpatient, consultation, emergency department, critical care, etc. Also, due to the E&M coding guideline change in 2021, so it certainly will be on the exam for sure. On the 00100 series CBT, only 4 questions compared to 8 in last year. It will be covering time reporting, qualifying circumstances, physical static modifiers, anesthesia for diagnosis, surgical and obstetric services. On the medical terminology and anatomy for all systems in the human body, only 4 questions in each category compared to 8 in last year. And again, my advice for you is only 1 minute maximum is allowed on this anatomy and physiology question. On the IC10-CM diagnosis, only 5 questions compared to 10 in last year. 5 questions will require proficiency in diagnosis for all the chapters included in IC10-CM, as well as total knowledge of the IC10-CM official coding guidelines. On the HCPC level 2, only 3 questions compared to 5 in last year. These 3 questions will be on modifiers, supplies, medication, and professional services for Medicare patients. On the coding guideline, there will be 7 questions compared to 6 in last year. And this session of the CBT test will again assess your knowledge and understanding of the IC10-CM official coding guidelines, CBT coding guidelines, and modifier use. Therefore, this will be the area that you should focus more in 2022. I hope you take note. On the compliance and regulatory, only 3 questions compared to 5 in last year. and these 3 questions will be related to services covered under Medicare Part A, B, C, and D, fraud and abuse, HIPAA, and NCCI edits. Finally, this is something new on the exam this year, which is the new section, Case Study. 10 case study will test your ability accurately code medical record documentation using IC10CM, CPT-4, and HCPC Level 2. To pass the exam, the same as last year, you need to achieve a passing score of 70% or higher, and it means that you must answer at least 70 questions correctly. In other words, they allow you to miss 30 questions. AAPC doesn't state that they require a passing score for each section of the test. So I believe as long as your overall score is 70% or higher, you pass the exam and you will be granted the credential. In terms of the format of the exam, the same as before, it is still an open book exam with all multiple choice questions. You still can take it either online or in person, and here's the price. If you take it online, there will be one attempt only, and it will cost you $399. However, if you purchase the exam this month, you will get a $50 discount, so it will cost you $349. On the other hand, if you take it in person, you will have 2 options. Either one attempt for $399 or 2 attempts for $499. And if you purchase the exam this month, they also give you a $50 discount, $344 for 1 attempt and $449 for 2 attempts. You should go with the 2 attempts option. It will save you $300 if you purchase them separately. Now, let's talk about how to prepare for the exam based on given information. I believe here's how they revised the exam in 2022. In order to reduce the test time from 5 hours 40 minutes to 4 hours only, they have to cut back the number of questions from 150 to 100 questions. On each question category, for example, 10,000, 20,000, 30,000, 40,000 service CBT, they will have to go to the question pools, review, and then manually remove unwanted questions to reduce the number of questions to 6 or 4. So the good news is, the questions are still the same. They are not harder. You are still being tested on the same concept. So whatever materials that you are using for learning, continue using it and studying the same way. The format of the question is still the same, which is multiple choice question. So with my reverse analysis, in other words, my backward approach, you should be able to narrow down the correct answer in the least amount of time. For those of you who are new to my channel, then you should watch all my videos in the playlist CBC Exam Prep and familiar yourself with my tips and strategy. Next, in this new exam, you can tell in all categories, the number of questions have been reduced except the coding guidelines. So I strongly believe they want to make sure that you understand the IC10 official coding guidelines, the CBT coding guidelines, and know how to apply these guidelines in coding new case study. I don't know if in the new section, 10 case studies will be multiple choice or fill in the blank question. Either way, if you have been watching my videos, then you should know how to look up CBT procedure codes for surgery and procedure using the main term in the index. That said, if you are new to my channel, then you should watch all my videos and take note. For the IC10CM coding guidelines, you should watch all my videos titled Equal Effect versus Positioning, anemia coding, coding for diabetes, coding neoplasm, how to code burns, how to code COVID-19. These videos will cover the chapter-specific coding guidelines in IC10CM. I will be working on a few videos about how to code septicemia, acute MI, myocardial infarction, labor and delivery this year. In terms of CBT coding guidelines, if you are new to my channel, then you should watch my videos titled Introduction to CBT, How to Code Wound Repairs, How to Code Lesion Excision, How to Code GI Endoscopy, How to Code Cardiac Device. Basically, you should watch them all. The more you know, the better chance for you to pass not only the CBC exam, but also all the coding exam as well. I will be working on a few videos to show you how to code the interventional radiology, drug infusion and injection this year. In conclusion, if you have been watching my videos, taking notes, and practice coding, then you should be able to pass the exam successfully. There is not much change. Everything is about the same, except the testing time and number of questions have been reduced. On the new section, 10 case studies. If you have been watching my videos and practice coding case study using the main term in the index, then you should be ready for this. Now you have an idea about the new CBC exam in 2022. Nothing much to worry about. I've got you covered. Remember, practice makes perfect, and the secret to getting ahead is getting started. So, are you ready? Let's do it. Question number 1. If you have been watching my videos, then you should know my reverse analysis. In other words, the backwards approach. Once you master this technique, then the process of elimination will be much more manageable. Your continued practice will help boost your confidence and overcome mistakes. Instead of reading the procedure report first, which you don't have enough time during the exam, and also you may or may not have a clue what you are reading or what surgery or procedure that they are performing if you are not a coder or never coded this type of surgery or procedure before. My backward approach is to analyze the answer first and then read the question or procedure report after. And I am the only one who developed this technique while I was in school. Many of you who use my backward technique have already passed the exam successfully. Follow my tips and strategy. B and C have the same code, C43.71, so they are in the same group. A and D have different codes, C12.83 and C44.702, so they are in two separate groups. Now you know there are 3 groups, so there are 3 codes for you to look up in your IC10CM book, G12.83, C43.71, and C44.702. Please pause the video and do it now. Assuming you already looked them up in your IC10CM book, and here's what you find. G12.83, Encounter 4, Screening for Malignant Neoplasm of Skin. C43.71, Malignant Melanoma of Right Lower Limb, including hip. And C44.702, Unspecified Malignant Neoplasm of Skin of Right Lower Limb, including hip. Follow my tips and strategy. You highlight the main difference between each diagnosis code, and when you're done, you can tell the only difference between C43.71 and C44.702 is C43.71 is for a malignant melanoma versus C44 G12.702 is for unspecified malignant neoplasm of skin, and G12.83 is for an encounter for screening for malignant neoplasm of skin. Now is the time for you to read the question or procedure report and find out. Let's read it. A 40-year-old male patient presents for wide excision of a 2.5 cm malignant melanoma of the right type. Based on what I just read and highlighted, you can tell this patient is presented with a malignant melanoma of the right type that needs to be excised. So C43.71 malignant melanoma of the right lower limb is the right code to report for this diagnosis. Having said that, we can eliminate A and D from here. B and C still remain. And the only difference between these two answers is B has 2 CPT codes and C has just 1 CPT code. Now, this is my advice for you, and you need to take note because it will save you lots of time, especially during the exam, when every single minute counts. Anytime you see a case study or question related to lesion excision, either benign or malignant, I want you to briefly see how the wound is closed. For instance, in this case, the area excised resulting in a 4.5 cm times 2.5 cm defect requiring rotational advancement flap closure. If you have been watching my videos and taking note, then you should know this coding guidelines. CPT coding guidelines. The excision of a benign lesion 11400 to 11446 or a malignant lesion 11600 to 11646 is not typically reportable with code 14000 to 14302. In other words, the code for rotational or advancement flaps already include the lesion excision codes. Based on this guideline, if you report any code in this code range 14000 to 14302 for the wound closure by advancement tissue transfer, then you do not report the excision codes. Having said that, you should not have 2 CPT procedure codes in the answer. Therefore, C must be the correct answer. Having said that, the correct answer to this question is C, C43.71 and CPT 14021. Now, for the purpose of learning, if you look up this code 14021, you will find that 14021 adjacent tissue transfer or rearrangement, scalp, arms, and all legs defect 10.1 square centimeter to 30 square centimeter. Based on the report, the defect size measure 4.5 centimeter times 2.5 centimeter, so 4.5 centimeter times 2.5 centimeter equal 11.25 square centimeter. Before we move on to the next question, I want you to open your CPT book, go to the page containing this code 14000 to 14302 and write a brief note to remind yourself. This code already includes the lesion excision codes, so do not code them separately, then highlight it. I hope it helps. Question number 2. Follow my tips and strategy. A and D have the same code, S42.452B, so they are in the same group. A and D also have the same code, S42.452A, so they are in a separate group. Now you know there are 2 groups, so there are 2 codes for you to look up in your IC10CM book, S42.452B and S42.452A, but you don't have to do it now. If you watch all my videos and take notes, then you should know that the first character S is related to injuries, and also the fracture 7 character A is for an initial encounter for closed fracture, and character B is for an initial for open fracture. So let's read the op report and find out. Post-operative diagnosis display comminuted fracture of the lateral condyle, left elbow. Based on what I just read and highlighted, the post-op diagnosis doesn't indicate that this is an open fracture, so any diagnosis code ends up with character B for open fracture is not the right code to use, so we can eliminate A and D from here. B and C still remain, and the only difference between these two answers is B has 29065, which C doesn't have. So I want you to open your CBT book and look it up now. I'll wait for you. Assuming you already looked it up in your CBT book, and here's what you find. 29065, application, cast, shoulder to hand, long arm. Now, this is my second advice for you today, and you need to take note because it will save you lots of time, especially during the exam, when every single minute matters. Anytime you code a case study or question related to fracture or dislocation, then you should know this coding guideline. Coding guideline, fracture and dislocation treatment CBT codes include the initial casting, strapping, and splinting. In other words, long arm and short arm cast, long leg and short leg cast, long and short splint for upper and lower extremity are bundled into the fracture repair codes. Now, based on the op report, an ORIF, open reduction, internal fixation, is performed, and the code for this surgical procedure will include the initial casting, so 29065 should not be reported separately. Therefore, the correct answer to this question is C. S42.452A and CBT 24579 with modified LT attached for the left side. And I believe this code 24579 is for an open reduction, internal fixation of the condylar fracture. Now you know, with my reverse analysis, in other words, my backward approach, in this case, you don't even have to look up the diagnosis code for S42.452A or B and CBT 24579, and yet you still can narrow down the correct answer. I hope you get it. Question number 3. Follow my tips and strategy. B and D have the same code, C34.11, so they are in the same group. A and C have different codes, D38.1 and C34.91, so they are in two separate groups. Now you know there are 3 groups, so there are 3 codes for you to look up in your IC10CM book, D38.1, C34.11, and C34.91. Please pause the video and do it now. Assuming you already looked them up in your IC10CM book, and here's what you find. D38.1, neoplasm of uncertain behavior of trachea, bronchus, and lungs. C34.11, malignant neoplasm of upper lobe, right bronchus or lung. And C34.91 malignant neoplasm of unspecified part of right bronchus or lung. Follow my tips and strategy. You highlight the main difference between each diagnosis code, and when you're done, you can tell C34.11 is for a malignant neoplasm of upper lobe of right lungs versus C34.91 is for a malignant neoplasm of unspecified part of right lungs, and D38.1 is for a neoplasm of uncertain behavior. Now you should know what your focus is when you read the op report. Let's read it. A patient with a lung mass in the right upper lobe present to the outpatient surgery center for a diagnosis bronchoscopy, and pathology report confirmed a diagnosis of oxal carcinoma. Based on what I just read and highlighted, this patient presented with a lung mass in the right upper lobe, and pathology report confirmed it is a carcinoma. So C34.11 malignant neoplasm of upper lobe, right bronchus or lung is the right code to report for this diagnosis. Having said that, we can eliminate A and C from here. B and D still remain. And the only difference between these two answers is B has 31625 and D has 31629. So please pause the video, open your CBT book and look them up now. I wait for you. Assuming you already looked them up in your CBT book, and because 31625 is an identical, so I will show you experiential. 31622 bronchoscopy, rigid or flexible, including fluoroscopic guidance when performed diagnostic with shell washing. 31625, this is an identical, so it includes all the information from the coverable. 31622 would is the parent code, except 31625 is performed with bronchial or endobronchial biopsy. 31629, this is also an identical, so it includes all the information from the coverable. 31622 would is the parent code, except 31629 is performed with transbronchial needle aspiration biopsy, trachea, mainstem, and non-lobar bronchus. Follow my tips and strategy. You highlight the main difference between each CBT code, and when you're done, you can tell 31625 is for a bronchoscopy with biopsy, and 31629 is for a bronchoscopy with a needle aspiration biopsy. Now you should know what your focus is when you read the procedure report. Let's read it. A patient with a lung mass in the right upper lobe present to the outpatient surgery center for a diagnosis bronchoscopy. Follow anesthetic to the airway. A fiber optic bronchoscope is introduced into the bronchial tree. A needle is advanced to a channel in the scope, and tissue is aspirated from the lung mass for pathologic evaluation. Based on what I just read and underlined, you can tell a needle aspiration biopsy is also performed bronchoscopically, so 31629 is the right code to report for this procedure. Therefore, the correct answer to this question is D, C34.11 and 31629. On another note, just for your knowledge, this code also includes the fluoroscopic guidance 77002, so it should not be assigned as an additional code. I hope you take note. Just a friendly reminder that if you enjoy what you have learned so far and appreciate my time spent for this video, then you could please pause the video, click the like, subscribe and share buttons below now to support my channel, and that would be great. I really want you to do well on the new exam this year and also to have more confidence at work. Thank you so much for your support, and we should move on to the next question. Question number 4. Follow my tips and strategy. B and D have the same code, E103493, so they are in the same group. A and C have different codes, E103293 and E113493, so they are in two separate groups. Now you know there are three groups, so there are three codes for you to look up in your IC10CM book: E103293, E103493, and E113493. Please pause the video and do it now. Assuming you already looked them up in your IC10CM book, and here's what you find. E103239, type 1 diabetes mellitus with mild non-proliferate diabetic retinopathy without macular edema bilateral. E103493, type 1 diabetes mellitus with severe non-proliferative diabetic retinopathy without macular edema bilateral. And E113493, type 2 diabetes mellitus with severe non-proliferative diabetic retinopathy without macular edema bilateral. Follow my tips and strategy. You highlight the main difference between each diagnosis code, and when you're done, you can tell both E103293 and E103493 are for type 1 diabetes, and the only difference between these two codes is mild non-proliferative and severe non-proliferative retinopathy. And E113493 is for type 2 diabetes. Now, you should know what your focus is when you read the procedure report. Let's read it. Post-operative diagnosis, type 1 diabetic patient with severe non-proliferative diabetic retinopathy, OU. Based on what I just read and highlighted, this patient had a type 1 diabetes with severe non-proliferative diabetic retinopathy, so E103493 is the right code to use for this diagnosis. Having said that, we can eliminate A and C from here. B and D still remain, and they both have the same code, 67040. However, B has modified LT for the left side, and D has modified 50 for bilateral procedure. So let's read the op report and find out. Operation: vitrectomy followed by laser photocoagulation, OU. Based on what I just highlighted, a vitrectomy followed by laser photocoagulation is performed on both eyes. The abbreviation OU is a Latin abbreviation meaning oculus utrique, or both eyes. Also, for your knowledge, OD means oculus dexter, or the right eye, and OS means oculus sinister, or the left eye. Based on the op report, a bilateral procedure is performed in this case, and I don't know if CBT 67040 is described as a unilateral or bilateral procedure, so I had to look it up. 67040, vitrectomy, mechanical bars planar approach with endolaser panretinal photocoagulation. Based on the code description, it is not described as a bilateral procedure, so we have to use modified 50 if it is performed on both eyes. Therefore, the correct answer to this case is D. E10 3493 CBT 67040 with modified 50 attached for a bilateral procedure. I hope you get it. Question number 5. Follow my tips and strategy. A, B, and C all have the same code, E6601, so they are in the same group. D has a different code, E6609, so it is in a separate group. Now you know there are two groups, so there are two codes for you to look up in your IC10 book, E6601 and E6609. Please pause the video and do it now. Assuming you already looked them up in your IC10 book, and here's what you find. E6601, morbid obesity due to excess calories. E6609, other obesity due to excess calories. Follow my tips and strategy. You highlight the key difference between each diagnosis code, and when you're done, you can tell E6601 is for morbid obesity and E6609 is for other obesity. Now, you should have an idea what your focus is when you read the question or procedure report. Let's read it. This 50-year-old female patient had been treated for her morbid obesity due to excess calorie intake. Based on what I just read and highlighted, this patient had been treated for her morbid obesity due to excess calorie intake, so E6601 is the right code to use for this diagnosis. That said, we can eliminate D from here. A, B, C still remain. If you look at the next set of codes, they all have the same code, I10 and G68.41. So we should not use this code for our process of elimination. Now, let's look at the third set of code. A and B have the same code, E78.01. C has a different code, E78.00. So please open your IC10 book and look them up now. I wait for you. Assuming you already looked them up in your IC10 book, and here what you find. E7800, poor hypercholesterolemia unspecified, and E78.01, familial hypercholesterolemia. Follow my tips and strategy. You highlight the main difference between each diagnosis code, and when you're done, you can tell E7800 is for poor hypercholesterolemia and E7801 is for a familial hypercholesterolemia. So let's continue reading the op report and find out. Her MBI is noted at 33.5. She has also been treated for hypertension and hypercholesterolemia. Based on what I just read and highlighted, familial hypercholesterolemia is not documented anywhere in the report. So we have to use E78.00, and C is the only answer that has E78.00. Therefore, the correct answer to this question is C, E6601, I10, E78.00, G68.41, and CBT 43770. I10 is for hypertension, E7800 is for hypercholesterol, G68.41, I believe this is for her body mass index BMI, and CBT 43770 is for a laparoscopic adjustable gastric band insertion. Now you understand with my reverse analysis, in other words, my backward approach, you will minimize the number of codes that you have to look up in your IC10CM and CBT books, and as a result, it will save you lots of time during the exam. In addition, the keywords that you highlight during the process will give you an idea what you should focus on when you read the question or the operative report. Instead of reading the entire operative report, which will take too much time and sometimes you don't have a clue what you are reading, but with my technique, you just find the keywords that match the CBT or IC10CM code description. I hope you get it now. That is all for now. Thank you so much for watching, for liking and sharing this video. If you find this video is helpful, informative, and easy to learn with this format, or if you have any suggestion, then please leave me a comment below just to let me know. I really appreciate it. Also, the more comments that you leave for me, the better chance for my videos will be reviewed by other people. So please continue to do so. Until next time, have a great day.